My name is Dr. Cozy. It's really nice to meet you. So, okay, really quickly off the bat, if I can just get you to verify for me your name and date of birth. Perfect. Okay. And looks like we have you here today because you're having some floaters, like blind spots in your vision. Okay. Before we go any further, if you wouldn't mind just staring right here in between my eyebrows. Okay. Good. So your pupils are equally reacting to light. Just needed to rule out some more serious issues right off the bat there. So, okay. Do you have any history of migraines, ocular migraines? That's when you see the aura, kind of like the zigzagging lights in your vision. Is that what that's looking like? Okay. Is this a constant thing that's happening to you? Is it triggered by anything in particular? You don't know, okay. How about any headache, any blurred vision, double vision? How about eye strain? Okay. Dizziness, loss of balance? Any history of hypo or hypertension? Low or high blood pressure? How about family history of that? Which side? How much time during the day on average would you say that you spend in front of screens, computer, your phone? No judgment, we all do these days. And how would you describe your current stress level? Yeah, scale of 1 to 10 is fine. Okay. And also, how would you describe your sleep? Do you have a sleep routine? Are you having trouble staying asleep, waking up frequently? Okay. Okay, well, given that you're not sure about your blood pressure, what I'm going to do is put a cuff on you that is going to be keeping track and sort of tightening and releasing over time. We like our patients to keep the cuff on because there is such a thing as white coat syndrome, which is when your blood pressure can actually raise due to some anxiety just from being at the doctor's office or a hospital. So we try to keep that in mind. Do you have a preference for arm? Neither do I. So, like I said, you're going to feel this kind of, sorry, I just need to line it up. You're going to feel this tightening and loosening over time, so don't let that alarm you, right? And just give Give it a second to do its thing. So again, I have my light right here, okay? This time I want you to focus on my light. So without turning your head, just keeping your head still if you don't mind. I'd just like you to follow my light, just using your eyes. Watching closely to make sure that I don't see any kind of sticking points while your eyes are tracking. Okay, once more. Good. I'm just going to take a listen to your chest if that's okay with you. Okay. Can I get you to take a deep breath in for me and hold it? Okay. Slowly exhale. Good. Again. Deep breath in and hold. Slow exhale. Again. Hold. And out. Okay. Last time, deep breath in and hold it. And breathe out. Okay. You can breathe normally. I'm just going to listen to your abdomen here. Everything sounds good. I'm just going to give your tummy a quick feel. Any tenderness or anything? That was my own stomach, sorry. I'm going to use my Fundoscope here to take a look into your eyes at the vessels, okay? So I apologize if it is a little on the bright side, but I need to make sure that I don't see anything normal here. I'm not seeing anything concerning. I'm going to take a look inside of your ears now. Make sure I wasn't rolling over any wires here. So, okay. Gonna feel me just lightly pulling the ear back. Ears are nice and clear. look at the other side. Other side. Gonna feel me pulling the ear back. So let's make it a better visual inside. This ear looks good too. No redness or swelling. Here is nice and clean, and tympanic membrane appears intact on this side as well. Scoop myself over. And let's take a quick peek inside of your nose. So, okay. And while I have my light out, if I can just get you to open for me so I can look inside your mouth. Brilliant. Okay. Just making sure your airway is nice and clear. Don't see any tonsil or swelling or redness in the back of the throat. Any sign of postnasal drip. And I'm going to sort of feel around your jawline, your throat. I'm going to be feeling your thyroid and looking for any sign of what we call lymphadenopathy. Just the presence of lymph nodes. Can I get you to swallow for me? Okay. And again. Thank you. I'm not feeling anything that would be concerning. So now I'm going to be testing your reflexes, okay? So it's going to be just very light taps, don't worry. So, I'm not finding anything, excuse me, remarkable on my general exam. So, what I'd like to do is actually bring in 2 of my colleagues, if that's okay. I would like to have someone from neurology as well as someone from ophthalmology come in and examine you and see if maybe they can find something on their exams that I just don't know to check, okay? So I'm gonna go up there and see if they have some availabilities, just because given the nature of your symptoms, I think it might be helpful to have somebody with more experience with these kinds of things help and figure out a diagnosis for you, okay? We want to make sure you get answers. So hopefully the wait won't be too long. I will have a nurse come in and check on you if it's going to be more than, say, 15 minutes ago, or 15 minutes or so, okay? Maybe I need neurology. Okay. If you need anything, there is a call button right there. Feel free to push it, okay? And I'll just take my garbage out of here with me. You sit tight. Knock, knock. Knock, knock. Hello there. You okay? Continue. Right. My name is Dr. Smythe, and I am the resident ophthalmologist here. I'm actually director of my department, and this here is the good Dr. Cranial. She's representing neurology.
I'm a neurologist here.
Mm-hmm. So, currently we are here on behest of Dr. Cozy. I will be performing an eye exam with you, and she will be running a series of tests herself using some different bits and bobs to perhaps sort out some sort of diagnosis for what's occurring with your vision.
we do some very similar exams. She uses a Penlight and so do I.
Thank you, Dr. Cranial. So, alright then. I would like to begin right away, just jumping into it. So, to start, as I hold up this piece of paper here, are you able to tell me where in your vision you're currently experiencing the blind spots, the different colored spots in your vision? Very good. Alright.
Interesting.
And then if you don't mind just focusing on my face right here between my eyes, I'm going to be lightly just good flicking my torch in and out of your eyes.
Isn't it funny how she calls a penlight a torch when it's a penlight? A torch is something they use in a medieval dungeon, isn't it?
Thank you. I will thank you, Dr. Cranial, to help and contribute to an environment where we are able to focus on what's at hand.
See, she says the darndest things.
Very good. And now, not moving your head at all, keep it perfectly still. Just like you to follow my light, just using your eyes. Nicely done.
Okay, well, since she got to run her 2 tests, I think it's only fair that I take my turn now and run 2 of mine, okay? So, if it's alright with you, I would just like you to look right here, right between my eyebrows, and I want you to tell me how many fingers you see me hold up, okay? Perfect. Okay, so I'm gonna start. Good. Good. Very good. You aced it. And now, jumping right into my next one. Right here, I have this ruler. And I just want you to tell me, is this point A, closer or farther away than point B? Very good. And how about, is this point right here, we'll call this one point B, closer than point A? Excellent. Okay. And how about, is this point closer than this point? How about A, B, and A and B? Now I'm going to turn it over so you can't see the numbers, just in case that was helping me cheat just a little bit. I'm sure it wasn't, but just want to make sure we get as accurate of a result as we can. this point closer than this point? Alright, and how about here and there? Okay, here and here, and here and here. Very good job. Now we're going to turn it sideways. And I want you to tell me this closer than here, and here closer to you than here. How about here and here? I know, it's getting tricky. And here and there. You did great. Right.
Again, Dr. Cranial, I would ask that you provide me with just a few moments of quiet that I might concentrate, although at this point it feels more like flogging a dead horse. I should have brought my own fundoscope, however I suppose we'll have to make do with this one. It's quite rudimentary, I would say. So I'm going to move myself slightly closer to you, and I might take a look more deeply into the vessels of your eye, as well as take a superficial look at your retinas, making sure that I see my light reflecting. Very nice. All right then.
Isn't that just a different kind of swing test?
I do appreciate your curiosity, and no, with this particular method I'm actually able to visualize the vessels in the eye, and I'm looking to make sure that I see a reflection in the retina that will help me and rule out any sort of cataract or artifact within the eye itself. Right. So now, this here is something called a retinoscope, and what I would like from you is, as I am examining your eyes here, if you wouldn't mind reading the words that you're able to recognize on the card.
Well, aren't those those flashcards so cute. Though to be honest, I think I would need glasses to see them myself, and I have 20/15 vision.
Yes. Well done. And this particular card also contains a series of words, and I would like you to invite or to focus rather on the words you're able to read. If your words too difficult for you to visualize, that's quite alright. Right. You may relax your eyes. We will be doing one more test here, and then I will give our good Dr. Cranial an opportunity to continue her examination. So this particular test is something called blink the threat. And what's going to happen is it's going to look like I'm going to poke you in the eye with my finger. I can quite assure you that I will not. But I'm just making sure that your blink reflex is intact. So, good, just like that. Well done.
My turn, and we're going to use these flashcards that I brought that were meant for adults with natural vision. So I want you to tell me, what number do you see? And now? And holding it over here. Good. Good. Very good. Got a lot of twos. Excellent. All right. another test, and this one is more hands-on. So what's gonna happen is you're gonna feel me squeeze, 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 and I want you to tell me when you feel me let go, okay? Okay. That's it. Here we go. Beginning. Feel me squeezing. Good. All right. And again. Very good. Good. What side? Good. All right. Got them all right. Good job. All right then. So, what I would like to do now is something called a brightness test. So, I'd like you to hold your hand up just like so, dividing your vision between the left and the right. And I'd like you to tell me, is my light brighter here or here? Well done. How about here or here? Here, here, here. All right. And here. Here. Brilliant. So then another thing, as I don't have a Snellen chart, a vision chart available for me in this room, what I'm going to be doing is writing a series of different words just on my post-it notes here. Let's hope she has good handwriting. Yes, let's hope. So what I would like you to do is just read the word that I will have written down. All right. Is it difficult to see? Looks like we have a thicker marker at our disposal. Try it one more time. Brilliant. Right. Now moving just a bit further back.
Very well.
Alright, me again. So we're gonna do some problem solving skills together. So we're gonna do some teamwork. It's gonna be easy peasy lemon squeezy, okay? So here I have a puzzle, and it's actually not turned on because sometimes this can give us some hints that aren't exactly that helpful. So what we're gonna do is, you see this rectangle right here? We're gonna do what we can to bring it to the top, and I want you to tell me what moves I need to make, okay? Okay, so what do you think? All right. Okay. Alrighty. Okie doke. Okay. Okay. Hey, look at that. You did a great job. Excellent. Okay. So I would say that your problem solving skills are intact. Alright. So then I'm going to do one more test with you, if that's okay. And for this one, I'm going to need you to close your eyes, okay? Alright. So you're going to feel me very, very lightly tapping on your face, and I want you to tell me where you feel it, okay? Okay. So good. That was a trick. Good. 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 All right, good job.
All right. Well, I do believe that this is the extent of the testing I'm able to perform in this particular exam room. I would quite relish having you visit my particular department so we would be able to do some more in-depth and specific examination, but for now I feel that it would be wise for us to step out and discuss with Dr. Cozy, and I would be quite surprised if Dr. Cranial has any more that she'd like to perform.
Actually, I think I'm all set too. And I also think it would be really neat for you to come and visit neurology so that we can do our own set of specified examination as well. But I think we should let Dr. Cozy decide that because you were her patient first.
Right then. So, we will be stepping out, if that's okay, to discuss. I'm not sure quite how much time to provide you with in terms of your expectations. If it's going to be quite long, we will send in a medical assistant or a nurse to inform you. Alright. Well done. So, do you have any questions for us before we step out? Very well. It was lovely to meet you. And please wait just right here. Cheers.